Hi, everyone. I'm Dr. Nina back with another TOVA Tuesday. How are you guys today? Where we talk to healthcare professionals, people in the community that are doing great things to help us learn how we can live a better quality of life. Last year, June 19th, as you know, is World Sickle Cell Day, and I had the honor of hosting a webinar in partnership with the We Love You Foundation and also Cincinnati Children's Hospital, which is called Surviving and Thriving After Gene Therapy, where we talked to a sickle cell warrior and champion, Mikiyah Butler, about her journey on being cured of sickle cell through a gene therapy clinical trial. And I thought that this would be a great idea to follow up to see how she's doing. It's been about a year since we last talked to see how she's doing today. And I'm so glad to have been able to connect again with Mikiyah. There's been some great things that she's doing in her life. And I also want to hear about her health and any setbacks that she may have had over this last year. Mikiyah, welcome to TOVA Tuesday. How are you today?
I'm good. How are you?
Good. So June 19th is World Sickle Cell Day. You're one of, I would consider, a warrior and someone who is a champion for allowing others to have an opportunity to be cured of their sickle cell. You have had a lot of complications, a lot of debilitating pain crisis. You took that leap of faith and said, I want to give an opportunity for myself to have a better quality of life. So now it's been since a year now, and you received your gene therapy treatment in January of 2020.
Mhm.
So I want to know how you're doing.
I'm doing great actually. I haven't had any pain or any other complications. I actually got my port removed in January because we no longer need it.
Mhm.
So I'm doing pretty great. In October of 2020, I did tear part of my ACL, which did trigger a crisis, and that was the only complication that I've had
Mhm.
since getting the gene therapy.
Okay. So have you had any like admissions for pneumonia, crisis, infection of the port, anything like that?
No, no admissions. The only times I've had an admission was to get like my bone marrow aspirate, so they can check my levels or to get my port removed. But other than that, no pain related admissions, infection admissions, nothing like that.
Mhm. And how often do you have to go to the Children's Hospital in Cincinnati to have follow-up visits?
Now it's every 3 months.
But what was it before?
It was about once a month.
Okay. And the Children's Hospital is about 2-hour drive from your house in Columbus. Is that correct?
About an hour and 45 minutes. Really depends on who's driving.
Yeah,
But
we talked about that, right? Especially
yeah.
in the crisis, it's like 75 miles per hour on 95, right? To get you there to the hospital.
Yeah.
Okay. So, because of that, how's your quality of life been? You're in college, right? And then you work for your parents' family business. Is that right?
Mhm. Yep.
Tell me about
So
that.
right now at work, the head manager is out on maternity leave, so I have to do her job and my job and school. So I'm waking up, doing school, hopping in the shower, going straight to work, getting off
Mhm.
about 8, going home, going to sleep, waking up, doing it all over again. And before, I don't think I would have had all the energy to even do it. I'm going on like my fourth or fifth week of just going back to back to back. So I think that doing the gene therapy and stuff has improved my quality of life in terms of like energy as well.
Mhm.
Because I'm able to do all that, but then on my off days, still go out and hang out and do stuff.
Wow, so you can have a normal life like any other young adult your age.
Hmm.
So you're saying you have more energy, you have more stamina. Has your blood counts been higher now with your gene therapy
Um,
treatment? Like, what's
yeah.
your hemoglobin run?
I want to say it runs around a 13.
Wow. What was
Yeah,
it
it's
before?
never been that high. So it is. I know for a fact that it is higher than what it had been with me having pain and all that stuff. And my gene therapy numbers, I'm not exactly like sure what those are, but I can tell you that out of all the participants at Cincinnati Children's that has done it, my numbers are the highest, and they still remain the highest from me having like from when we first started. Um, so they always tell me that I'm acing my tests and my exams. So yeah.
Wow. And how many participants are in the clinical trial at Cincinnati's Children Medical Center that you
Um,
know of?
I was the third. I
Hmm.
want to say they're working on one more that's about to complete, so that would be four. But I do know that they have a couple of others like signed up, gearing to get into it. I have been trying to talk to some of my friends to get into it as well. So we'll see how that goes. But as I know, it's about 4 or 5 people that have like done it so far.
Wow. So working two jobs, going to school. Where are you today? What's
Um,
going
as
on?
of right now, I'm still in school. I'm waiting to get accepted into the sign language interpreting program. So I got all like my prerequisites done in terms of like the first and second and well, only the first and second sign language class and like all the math classes are out of the way. And right now I'm working just the one job at my mom's. And that's about it. I'm
That's
pretty
enough,
bored.
right?
Yeah, that's enough. So between teaching the classes at work and doing office stuff and doing school stuff, that has my schedule.
Right. Well, I wanted to ask you, Mikiyah, there has been a biotech company that had to temporarily suspend their gene therapy clinical trial because two patients developed cancer, which may have been attributed to this lentiglobin gene therapy approach that they used to cure sickle cell warriors of this debilitating condition. What are your thoughts about that?
Um, I mean, I knew it could have been a possibility because it was in the consent when we signed it. Um, but I don't know. Like honestly, I haven't really thought about it. But I guess it's a possibility that it could have came with it. I mean, when I talked to my doctors about it when they called me to discuss it, they wanted me to know that they had been using their type of chemo that they had used for me
Mhm,
on different patients and stuff like that. So like for years and years. So it
mhm,
they didn't have any concerns on their end about it because nothing had ever popped up. So I wasn't really concerned about it, if that makes sense.
mhm. How do you feel about those warriors who have passed away? That's a possibility that it could have been a complication of the gene therapy. What would you say to their loved ones and their family?
Um, it's unfortunate, you know, just because you signed up for something thinking that it could have saved your life, and then you get leukemia, and it took a different turn. But they just know that them passing, I want to say that it helped the staff figure out where things went wrong, or it could potentially help the staff to figure out where things went wrong. Because when I went into the gene therapy, my thought was if it does not work for me, they can figure out where it went wrong and potentially help somebody else. So they're taking all that and working with it. Unfortunately, it had to be your family member, but it's science, it's helping. So yeah.
Mhm. And we have to continue to fine tune these protocols to find out the best approach in order to mitigate harm
Hmm.
and make sure that we have the best evidence-based practices in these
Hmm.
protocols to move forward. Wow, it's been great to see you. You're just such a lovely and beautiful young lady. Do
Thank
you
you.
have any last minute comments that you want to share to our community about you and what you're doing?
Um, Not necessarily about me. Um,
Mhm.
but I would just say get out and do what you can. Try your best to advocate, whether it's for the people that you know or for the people that you don't know, because we need it. If it's not us doing it, then who is it? You know.
Right, exactly.
So just get out and do the best that you can.
Awesome, awesome. Wow, Mikiyah, I want to thank you for coming on TOVA Tuesday. And I just wanted to let the community know to please subscribe to TOVA Health TV and like us on Facebook or Instagram at TOVA Community Health. I will also put a link to last year's forum, Surviving and Thriving After Gene Therapy, where I talked to Dr. Malik and Mikiyah about her journey towards a universal cure. I want to say thank you, Mikiyah, for
Mhm.
coming on TOVA Tuesday today.
Thank you for having
And I look forward to talking to you again and connecting with you just to stay in touch and see how you're doing.
me. Yes, ma'am.
Thank you so much, Mikiyah. You have a great day, and we
Thank
will
you.
talk soon.
Okay.
Take care.
Bye bye.
Bye-bye.
All right. Am I good to